Primary care in South Africa. South Africa is the largest and most economically developed country on the African continent, also in the medical sector. In general, financing of the health sector from the national budget is quite high and comparable to that of developed countries, 8, 8% of GDP is allocated here to medical services. All health centers are divided into private and public, and the level of equipment in public hospitals is comparable to that of the private sector. However, according to the WHO, South Africa has a fairly high rate of HIV infections and AIDS patients among the population. Furthermore, the health system continues to present gaps and problems. Medical staff. Healthcare workers include general practitioners, professional nurses, super nurses, and enrolled nursing assistants, and pharmacy personnel, pharmacists, and pharmacy assistants, working in the public, private, or non-governmental organization (NGO) sector.
Hello, my name is Carlis Mateo Montero, and I'll be talking about private health insurance in South Africa. With a private health insurance, the people has the right to choose your own doctor and how to see a doctor without a long waiting time. Patients with private coverage have the freedom to choose their own GP, whether in the health centers or clinic, and can also consult a specialist without needing to be previously referred by their GP, unlike those who wish to be covered by the public system. As for South Africa public hospital, not all offer the same quality of service. However, the wait to be seen is usually long, since the center serves 80% of South Africa's citizens. There are a wide variety of private medical centers in the main cities of South Africa, from small clinics to large medical centers. Private clinics there offer a wide range of health services and quality dental care of women and children. Alternative medicine continues to play a considerable role in the South Africa healthcare system. About 80% of people go to health labs to treat health problems. These figures are higher in rural areas. Traditional healers are alternative health practitioners are regulated by Allied Health Service Act 1982. All alternative health practitioners must be licensed and quality.
Today I'm talking about medicine and healthcare in South Africa. Pharmacies in South Africa. There are pharmacies in almost all regions of South Africa, and medicines are usually relatively cheap. This is because drug prices are set by the national government. There is also a drug price taker that you can use to find out the price of a specific drug. Medical service. Fewer documents are needed to register in the South Africa healthcare system that in many countries, Westerners. A resident can make an appointment with a local doctor by filling out a form and present only an identified document, passport, and proof of residence in South Africa. If a resident does not have the right to public health care or prefer to use private medical service, he or she can register with a private doctor and go to private medical center. A private insurance policy can cover certain costs of private medical service.
Hello, my name is Melody Fuentes, and now I'm going to talk about the peculiarities of the South African healthcare system. The South African healthcare system faces several challenges and particularities at present. The first one is diversity and inequality. South Africa has a highly diverse healthcare system comprising a mix of public and private services. However, significant disparities persist in access to and quality of healthcare between urban and rural areas, as well as among rich and poor populations. HIV/AIDS. South Africa has one of the highest HIV/AIDS rates globally. Despite significant strides in HIV treatment and prevention, it remains a major concern for the healthcare system. Access to medications. Despite efforts to improve access to essential medications, including antiretrovirals for HIV, challenges persist in terms of availability and affordability of drugs for many individuals. South Africa. Disease burden. The country bears a substantial burden of disease, including infectious disease such as HIV/AIDS, tuberculosis, and malaria, as well as non-communicable disease like diabetes and cardiovascular disease. Human resources. There is a chronic shortage of healthcare personnel in South Africa, especially in rural and underserved areas. This places additional strain on the healthcare system and hampers the delivery of quality care equability across the country. Universal health coverage. South Africa is working towards implementing a national health insurance system aimed at providing universal health coverage to all citizens. However, this process faces challenges in terms of funding, infrastructure, and administrative capacity. And the last one is infrastructure challenges. The South African healthcare system often grapples with infrastructure-related challenges, including inadequate medical facilities, outdated equipment, and poor maintenance of healthcare buildings. In summary, while South Africa has made significant strides in healthcare, it still confronts significant challenges regarding access, equality, and quality of healthcare delivery. So that is all. Thank you so much for seeing my part of this group. So thank you.